conducted this on the 27th of April, 2025. I must say, maybe I graduated here and I schooled here. I have not witnessed the white coat ceremony, except when the provost conducted. So it was quite a novel program, and it was normally introduced at year 4. And it's not an adult exercise too. I just put this, that for you to become a doctor, it's not just the ceremony we see today. It starts as far back as your secondary school, where you have to do well in your UTME and WAEC exams for you to qualify to do this. And as stated by the National University Commission and CCMAS, CCMAS is the standard document for training of doctors. The doctors will navigate year 1, year 2, year 4, year 5, year 6. And in Nigeria, we have a 6-year program. Some may be 5 years, whereas in other countries it will be 8 years. So it is not a tea party to train and to be trained as a doctor. So the oath you take today is well deserved because you work for it. I just put this. After you have graduated today, you go through your internship and youth service. Most doctors, when they graduate, they have a default exit area. Most of them will do residency program, 40%, private practice, immigration. The JAPA syndrome is what they call the immigration there. Some will go into NGO or health, public health, others administration and teaching. This statistics was taken in 2023 or so. So I'm quite sure if this statistics is taken today, the picture may not be like this. Particularly for the immigration, it may be much higher than this. And I know, and we know why. I put this party politics and business. Party politics is becoming a very interesting part. And I must say this on a very personal note, that I'm always not happy that doctors are not involved, fully involved in party politics. That's where it is happening. Whatever you write, whatever you practice, and if you are not there and you send your proposal, they will just trash it. But if you are there, they will even try to modify your proposal to fit what they want. So what I'm saying in effect is that it will not be out of place that as you are graduating, you consider getting, it may be a subtle way of telling you can join party politics to make the impact, not only for your society, but also for medical practice. I remember most times we write, go on strike, do all sorts of things. When you send the memo will not be considered, basically because we are not in the core area where decisions are taken effectively. And business too. Many doctors are in business, but not as in. For example, oil and gas and other associated business that will bring into the society. And more importantly, we've just been, if I see the Dean Emeritus, we just had training on cybersecurity and data. That is the hallmark of current and contemporary practice. If somebody can vet the data management and cyber management. I just decided to put this. Maybe I will not bore us with this. The landscape and the challenges we have in the practice of medicine in Nigeria. You could see it fraught with inadequate infrastructure, human resource crisis, high disease burden, low health insurance. We know all this. Fragmented and inefficient system and limited public awareness. I just put this graph. I hope, yeah, it's clear. Just put this graph for us to see the policy instability and low funding. You can see in the graph there, in 24, sometimes you can talk when you see something you can do, and because of no money, no this, no that, or sometimes no resources to deal with the patient, it can deter you. So if you have resilience for you to be creative because of resource constraint, and which and your creative thinking. More importantly, I keep emphasizing this, that evolving new world of doing things, and particularly technologies. I mentioned a few of them. AI is there for, you may not know, it's very good for diabetes, for treatment and gynecology. So if you go into it and try to develop, you have to make more impact in terms of innovation.